Hi friends, my today's topic is very common, that is most popular cosmetic surgery, that is liposuction. I found that during practice liposuction has many myths and questions and doubts about its outcomes, whether fat is permanent, whether fat is going to recur, or whether the patient will regain the weight, like that. And what is actual liposuction? See, liposuction is commonly known as lipo or lipo-sculpture or lipoplasty. It is nothing but plastic surgical removal of excess unwanted fat which is resistant to exercise and diet from any body areas, and the purpose is body contouring. It is purely an aesthetic procedure where a person who is fed up of extra fat deposits which are causing deformity, which are hindering specific body clothes use of that person, to get rid of such unwanted fat. This is a very simple procedure, straightforward procedure, where there is a 3 to 5 mm cannula. That cannula has a hole, and that cannula has different lengths, and this cannula is passed beneath the skin at the fatty layer, and using a suction device the fat is sucked out. So the results are instantaneous. Immediate results are seen, and immediately the fat is physically removed from that person's body. So the results are immediate and results are permanent. The fat is permanently removed out of your body. So what are the indications of liposuction? Any person who is healthy, who is fit for anesthesia and surgery, and who want better body contour, and who want to remove extra body fats, unwanted body fats from certain areas of body for aesthetic purpose, is a indication for liposuction. Liposuction is not alternative to unhealthy diet or not doing exercises, unhealthy lifestyle. A person has to continue and has to be healthy and should continue healthy habits, healthy lifestyle even after liposuction. And also remember, liposuction is not a weight reduction procedure. It is a body contouring procedure. Yes, there is a reduction of weight after liposuction, especially in case of mega liposuction where more than 10 liters of body fat is removed. There is a loss of weight, and most important is there is a inch loss, and there is a good body contour after liposuction. And liposuction is worldwide one of the most demanded, most popular, and statistically most commonly done cosmetic procedure. Why it is so popular? Because it has good results, it is rewarding. So what are the areas where we can do liposuction? These are common areas. This is chin, you can see the double chin, thick arms, then abs or stomach, outer thighs, inner thighs, inside of the knees, and calf, buttocks, outer thigh. These are common areas from where fat can be sucked out. And at a time, around 5 to 10% of total body weight can be sucked out safely. If the liposuction is less than 2 liters, then it is a daycare procedure, and it is generally done under local anesthesia. So relatively it is a minor procedure. If the liposuction, that is aspirate, the fat removal, is more than 2 liters, then it generally requires general anesthesia or regional anesthesia like spinal or epidural. And we see to that preoperatively patient is fit, healthy. If you want to go for liposuction, you have to follow doctor's instructions regarding medications. You have to stop aspirin, NSAIDs, and if you are a smoker, you have to stop smoking 8 days before. And you have to get physician fitness for undergoing anesthesia and safe surgery. As it is a pure cosmetic surgery, patient has to be fit, and there should not be any risk. But mind well that it is also safely can be done in case of diabetes, in case of hypertension also, with medications as advised by the physician. So as I said, before surgery you have to undergo basic investigations. The plastic surgeon will analyze you, and he will discuss with you which body areas to be aspirated. And also I want to tell you, most important is liposuction should be done by a plastic surgeon who has experience in aesthetic procedures. That person should be, that doctor should be a board certified, university qualified MCH or DNB plastic surgery for better results and safe results. I will show you some examples where liposuction is being done. This is a young male where he had more fat on the chest, abdomen, then on the waist, and this is after removal of the fat. He was going for a marriage after 6 months, so he underwent liposuction body contouring procedure. You can see this. Abdomen, you can see this was the pinch test before liposuction, and this is after liposuction. And this is the maximum amount of fat which in Bembde hospital we have removed. This was around 19 liters of fat aspirate in a lady. She was weighing 110 kg, and we safely removed this much amount of fat. So this is not a routine, but we have to assess the patient, how is the patient, and if patient can sustain these things, we go for it. These are common areas of outer thighs where liposuction is done. As I said, at the arms, some patients, particularly female, may have thick arms. So we remove fat, and this is the result of liposuction. Some female may have these folds beneath the bra strap. This can be improved with liposuction. This is also a very common demand that certain female, because of this extra fat, cannot wear trousers or pants. So they come for liposuction. It is a single hole surgery. With a single hole, we have removed all the fat, and now she is fit. This was the fat removed from her body. This was another female having huge fat deposits on the buttocks and thighs, and we have removed it after surgery. Another case where we have removed 16 liters of fat just from the buttocks and thighs. You can see the result. Any body part which is having extra fat deposit, we can remove the fat. Even this female, she was having a double chin or extra fat deposits at the chin, and we have removed the fat. Sometimes patient may have extra abdominal skin laxity. There, along with liposuction, we have to do tummy tuck. Tummy tuck, where there is a excision of skin along with the fat. Like in this patient, we have removed the fat with liposuction and also done tummy tuck. This is a common demand in male to remove extra fat deposits from the chest, which we can remove with liposuction. This was the amount of fat that boy had, and after removal of the fat. This is a common complaint in youngsters where there is extra fat deposits, and with liposuction we can correct the chest. So some patients, this lady had a big lipoma, so she did not wanted a scar of surgery. So we are removed with a single hole, we are removed all the fat. So this is how the liposuction can be beneficial in case of body tumors also, lipomas also. What are the benefits of liposuction? Liposuction is a permanent procedure. Liposuction removes the fat physically from your body, from particular areas from where the fat is not going away even with exercises and diet. That resistant fat or dystrophic fat can be removed with liposuction. And this is a safe procedure provided the plastic surgeon analyzes you properly before surgery and gives fitness from a physician. So it is the most rewarding surgery. Not only weight, it also improves your contour by inch loss. So double benefit is there. So what are the precautions you have to take after the surgery? Generally, we advise rest for few days depending on the amount of fat aspirated. We provide liposuction garment, that is a compression garment. It is a lycra elastic garment that helps to have good contour of the skin which has become loose after liposuction. That you have to use for 6 to 8 weeks. And we give some analgesics and antibiotic for few days. After say 2 liters or 3 liters of liposuction, you can resume your duties after 3 days. But if the liposuction is more than 5 liters, you may take 7 days to resume your duties. If you maintain your weight which was there at the time of after the surgery, then definitely the fat is not going to recur. You will have your body contour as it is, as it was done during surgery. But if there is a weight gain because of any reason, an unhealthy lifestyle, even then also body contour is maintained, because the extra fat deposits is not directly going to deposit at the areas from where the fat is sucked. It will be evenly distributed in the body. So there is a benefit. But I will request such persons to follow healthy lifestyle to have this result permanently and in the best of way. Thank you so much. Thank you. Bye bye.